My name is Mary Jane Abelihi. I am a student nurse here at TTUHSC School of Nursing. Today I will be performing a head-to-toe assessment on Mrs. Temi right here. So here I just have my clean sheet of paper. I already washed my hands, put on a clean glove and all of those good stuff, so I am good to go. I'm just gonna go ahead and introduce myself to my patient. Okay. Hi, good morning. My name is Mary Jane. I am a student nurse here at TTUHSC School of Nursing. Today I'll be performing a head-to-toe assessment. I just want to let you know this might require me touching some certain parts of your body, and I just want to make sure I have your consent for this. Okay. Okay, can you confirm your first and last name for me?
Temi Fakoya.
Okay, thank you. Can you confirm your date of birth?
98.
Thank you. Are you allergic to anything such as like that?
No.
No. Okay, my patient is good to go. My patient, I'm just going to go ahead and start. Okay. Yeah, maybe another one. You ready? My time to go.
Yeah, keep going.
Put your thing down.
Sorry. I was just trying to turn down the volume.
Okay, can I get your hands, please? So I am just assessing the skin. The skin is uniform in color. It is warm to touch. It is dry. No lesion or laceration noted. Checking for skin tinting. There is no tinting in the skin. Can I get your nails, please? Hygiene is adequate. Clean. Can you make your hands like this way? Okay. So there is no clubbing found, and capillary refills is less than 2 seconds. Okay, so I'm gonna go ahead and touch your head, okay? At any point, if you feel pain, let me know, okay? So I'm looking at the hair. The hair is well groomed and evenly distributed. There is no sign of of pediculosis or protrusion. There is no indentation to the scar. Do you feel any pain?
No.
No tenderness noted. So I'm gonna go ahead and assess your face, okay?
Okay.
If you can please open and close your mouth. Close it. Okay, so the temporal mandibular joint is free from crepitus. Can you clench your teeth? Okay, so the temporalis and masseter muscles are strung equally bilaterally, and cranial nerve 5 trigeminal is intact. Okay, so the next thing I'm going to do, I'm going to feel some part of your head, okay? If you feel pain, let me know, right? Any pain?
No.
Any pain?
No.
Okay, so the frontal and the maxillary sinuses are non-tender. Okay, so I'm going to have you do some series of movement for me, okay? With your eyes and everything. So the first thing, you're going to move your eyebrows for me, up and down. Okay, you're going to go ahead and smile, frown, puff your cheek. Okay, so cranial nerve 7 facial intact. So the next thing, I'm going to check for light touch, okay? So I'm going to go ahead and you're going to close your eyes, and each time you feel something, say now.
No. 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 No.
Okay, so patient feels the touch, so cranial nerve 5 trigeminal is intact. Ooh, good boy. Okay, so those head. Okay, so I'm gonna go ahead and assess the eyes, okay? So I'm just looking at the eyebrows. The eyebrows is symmetrical. Eyelids are intact. Eyelashes are well distributed. There is no redness or swelling noted. Sclera is white. Iris is round, symmetrical, and no lesion noted. I'm gonna go ahead and press down on your eyes, okay? You look up while I do that. Okay, so the conjunctiva is pink, moist, no excessive tearing or lesion noted. So the next thing I'm gonna do is I'm gonna have you look straight down, okay? I'm gonna go ahead and check your eyes. Just look straight down for me, okay? Okay, so corneal reflex noted bilaterally. Okay, so the next thing I'm gonna have you do is I'm gonna have you look straight at this light while I bring it close to you, okay? Just follow with your eyes. Okay? So the pupil is round, equal, react to light and accommodation. Okay, so the next thing I'm gonna do is I'm gonna have you look right at this light, and you're gonna follow with just your eyes, okay? Each area I go. Okay, so cranial nerve 3, oculomotor, cranial nerve 4, trochlear, and cranial nerve 6 abducens are all intact. And this includes the superior and the inferior oblique, and the medial and the lateral rectus. They are all intact. Okay. Okay, so I'm gonna go ahead and check your ears, okay?
Okay.
So I am checking out both ears, and there is no lesion noted or no excessive discharge. I'm gonna touch on your ear. Let me know if you feel pain at any point. Do you feel any pain?
No.
Okay, so the pinna is free from pain, no masses, no discharge, yeah, no lesion noted. So the next thing I'm gonna do is you're gonna go ahead and face it for me, please. I'm gonna whisper 3 words to you, okay?
Mm-hmm.
Let me know if you hear them, if you can repeat those 3 words back to me.
1, 2, 3.
Correct?
1, 2, 5.
Okay, great. So whisper words heard equally bilaterally on both ears. Okay, so okay, I'm gonna go ahead and check your ears, okay? I'm gonna touch some parts of your face. At any point, if you feel any pain, let me know, okay? So I'm just gonna go ahead and assess the lymph nodes. So this is the pre-auricular, post-auricular, occipital, tonsillar, superficial cervical, posterior cervical, deep cervical, supraclavicular, submental, and submandibular. Did you feel any pain?
No.
Okay, so all lymph nodes were non-palpable, non-movable, and non-tender. Okay, so I'm gonna have you stand up. You're gonna perform some series of movement, okay? So the first you're gonna do is you're gonna get your chain on your chest like this. Okay, and you're gonna put your head up. Okay, next you're gonna move to the side and to the other side. Okay, so full range of motion noted on the neck, okay? So the next thing you're gonna do for me is you're gonna start with your hands by the side. You're gonna abduct, you're gonna bring your hands together and abduct. You're gonna take your hands back to where you started from. Okay, so the next thing you're gonna do is you're gonna do some external rotation for me, okay? You're gonna get your hands, you're gonna put them like that behind you. Okay, so the next thing you're gonna do is you're gonna make some internal rotation. So you're gonna get your hands and you're gonna put them like that behind you. Okay, thank you. So full range of motion was noted on the shoulder as well. So the next thing you're gonna do is you're gonna get your elbow, okay? You're gonna flex it, bring it closer to you. You're gonna extend it. Get your hands down. Now you're gonna bring back your hands up, okay? And your palm facing up, and then now you're gonna take your palm facing down. Okay, great. So full range of motion noted on the elbow as well. So the next thing is you're gonna do the same, but this time you're gonna work with your wrist, okay? So you're gonna flex, bring it together like that. Okay, now you're gonna extend. You're gonna iso-extend. Okay, so full range of motion noted for the wrist as well. Stop that. Next, we're gonna do the ulnar and the radial deviation, okay? So you're gonna get your hands out like that, and then together. Okay, great. So full range of motion was noted for both the neck, the shoulder, the elbow, and the wrist, as well as the ulnar and radial deviation was all done. Go ahead and sit. So now the next thing we're gonna do, I'm gonna go ahead and press down on your shoulder, okay? So you're gonna try to bring your shoulder up against my resistance, okay? Go ahead. Okay, we're gonna do the same, but this time my hands are gonna be at the side of your face, okay? So go ahead and turn. Okay, go ahead and turn the other way. Okay, great. So cranial nerve 11, cranial nerve 11, spinal accessory intact. Alright, so now I'm just gonna go ahead and check your lungs, okay? So go ahead and just sit up for me, like that. So right now I am assessing the anterior and the posterior transverse ratio, which is 1 to 2. So the next thing we're gonna do is I'm gonna go ahead and I'm gonna put my hands right there, okay? You're gonna go ahead and breathe. At any point, if you feel any pain, let me know why I touch, okay? Go ahead. Did you feel any pain?
No.
Okay, so no tenderness noted. Okay, go ahead. Any pain?
No.
Okay, so chest expansion was symmetrical, no tenderness to palpation. Okay, so the next thing we're gonna do, Jesus, Laura, sorry. So the next thing we're gonna do, I'm gonna go ahead and listen to your lungs, okay?
Okay.
Come here, Mommy. See. Sorry. Steady. I'm gonna go ahead and listen to your lungs, okay? So I'm gonna listen to 4 areas of your lungs. Each time I place my stethoscope, just go ahead and breathe in for me, okay? Okay. 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 Go ahead and turn. Okay. Okay, thank you. So, vesicular breath sound was clear, equally bilaterally on both sides. There was no adventitious breath sound with it. So we're gonna go. Let me see. Okay, so we're gonna go next. I'm gonna go ahead and check your heart. Okay. So right now I'm just assessing the heart. I'm assessing the precardium of the heart. And there is no abnormal pulsation found. So next, I'm gonna go ahead and touch some parts of your heart, okay? So this is the aortic side in the second intercostal space, okay? This is the pulmonary side in the second intercostal space. This is the S point in the third intercostal space. Okay, put my hands there, okay? And this is the tricuspid in the 4th to 5th intercostal space. And here, it's the mitral area, which is also the mid-clavicle point, in the 5th intercostal space. So I'm gonna do the same, but this time, I'm gonna go ahead and listen to the sounds, okay? I'm gonna listen with the stethoscope, and I'm gonna listen with the diaphragm. But while I palpated, there was no trills or apes noted. So I'm gonna go ahead and listen. You don't need to breathe, okay? Okay, so I'm gonna do the same, but this time I'm gonna do it with the belt. Okay. Sorry. Okay. So S1 and S2 was head and not diminished. S3 and S4 was not add. There was no murmur add to the systolic and the diastolic. Okay, so next I'm gonna check the abdomen, okay? Hold on. Okay, go ahead and lay down for me, flat. Let me stop. Sorry. So I'm just gonna cover the areas that I'm not gonna work with, but get it right here. I don't have anything right now, but I would cover the areas on the normal circumstance. So I'm just gonna go ahead and I'm assessing right now, and the abdomen. Sorry, baby. The abdomen is flat, symmetrical, no masses noted or laceration noted. So the next thing, I'm gonna go ahead and listen to it in the 4 quadrants, okay? Okay, so Boris sound was heard on 4 quadrants. So next I am gonna go ahead and pick us, okay, in the 4 quadrants as well. Okay, so timpani predominates on all 4 quadrants. So next I'm gonna go ahead and press slightly on your abdomen, okay? If you feel pain at any point, let me know, okay? You feel any pain?
No.
Any pain?
No.
Any pain when I touch it?
No.
Okay, so the abdomen is soft, no tenderness to palpation, no mass is noted. Laura, you're gonna fall. Okay, okay, so we're gonna now. I'm just gonna go ahead and assess I'm gonna go ahead and assess the lower extremities. Okay, so I'm just assessing, and the skin is uniform. It is warm to touch. It's dry. No laceration or lesion noted. There is no edema noted. The capillary refill is less than 2 seconds. I'm gonna go ahead and check the tibial pulse and the dorsal pelvis pulse. Don't die. Okay, so both the tibial pulse and the dorsal pelvis pulse are all +2 equally bilaterally. +2. Okay. Okay, so the next thing I'm gonna do, okay, I'm gonna go ahead and I'm gonna have you close your eyes again for me a second time. This time I'm gonna touch some part of your legs and your arm, okay? If you feel it, just say now. Okay? Close your eyes. Close your eyes.
Now. 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 Now.
Okay, so light touch was noted on both the arm and leg and intact. Okay, so next I'm gonna have you sit up, just sit like you would normally. So I'm gonna go ahead and check the tender reflexes at this point, okay? So give me your arms. Just like let it go. Just let it go. Okay. Okay. You're stuck along the same. Just let it go. Okay. Just leave your legs. No, like sit normal.
Okay.
Just let your legs go the way you do. Like go up and sit up so you can look. Okay, like that. Okay, go ahead and like hold your hands like this, like you're trying to grab onto the. I'm just gonna go ahead and check the patellar reflex as well. Your legs was like this swing. Yeah. So I'm gonna go ahead and check the patellar reflex now. Okay. So the bicep and the patellar reflex are +2 equal bilaterally. So the next thing I'm gonna have you do is you're gonna help me out to do some setting movement, okay? So right on your leg, you're gonna try to move your hands as fast as you can. Okay. So the next thing you're gonna do is you're gonna try to like dab, but you're moving your no, your fingers have to touch your nose, okay, like this.
Oh, okay.
As fast as you can. As fast as you can.
Is that going further? Is that
like that. Mm-hmm.
Oh.
Yeah. Okay, thank you. Okay, so rapid alternating movement of arms, finger to nose, is smooth and intact. So the next thing you're gonna do, stand up. Okay, so you're gonna put your hands to your side and you're gonna close your eyes for me. I'm gonna count to 20. So go ahead, I'm just trying to make sure that 1, 2, 3, 18, 19, 20. So open your eyes, go ahead and sit. So on a normal circumstance, on like standardized patient or a real life situation, I will like count up to 20. But for the sake of testing, I just do that. Okay. So, but the remember test is negative. So the next thing you're gonna do is you're gonna have to walk for me, okay?
Okay.
But I'm gonna have to fix this camera in a way. So you're gonna start from there. Go ahead and start from there. But this time you're gonna walk like with your heel touching your toe. When I say go, you go. Let me move my camera. Okay. All right. Go ahead. Walk. Go. Keep walking. Keep walking. Okay. Then just go ahead and walk back. Just walk back like normal. Just normal. Walk back normally. Okay. So the tandem walking was smooth and done without losing balance, and also the gait was smooth, well coordinated, with the arm moving, swinging freely. Okay, so the next thing we're gonna do is we're gonna do the snelling shot. Okay, so you're gonna close one of your eyes and you're gonna read a line for me. Okay, so just stand right here. No, like right here. Let me move the camera. Let me move the camera. So, okay, go ahead. Stand right here, just right there.
Okay.
Okay, and you're just gonna go ahead and that is the snelling shot right there. I don't know if you can see it. Oh, okay, the snelling shot is right there, up there. Oh, like I'm gonna break it. Oh Jesus, this is a mess. Okay, oops. Okay, just go ahead and read it. Read line 8 for me.
Okay.
Line 8. This line.
E.
You're gonna cover one eye, okay? With one eye.
D E F
Mm-hmm.
P O T E C.
Okay, go ahead and cover the other eye, and we do the same. Read
D E F
Mhm.
P O T E C.
Okay, thank you. Go ahead and sit. So the vision acuity is 20 out of a 20 with the snelling shot. This was done with glasses on. So I think this concludes my assessment. So at this point, I'm just gonna let the patient feel comfortable and let her know that the doctor is gonna be with her. So thank you so much for letting me do this assessment on you, okay? I've gone and gathered all the necessary information that I can. I'm just gonna go ahead and let the doctor know that you're ready. He's gonna be with you shortly, okay?
All right.
Thank you.